Thank you very much, Paul. It's always a pleasure for me to be able to speak, from a more social science perspective alongside maybe a more natural science perspective. And I do think there's one thing that we've learned in AMR. It's that these different disciplines need to go hand in hand and need to work together. So if all is going according to plan, you should be seeing my screen now.
We can.
And indeed, I'm interested in antimicrobial resistance from the perspective of communication, and not only communication, but just communication in the sense of fairness and social justice, and looking for, understanding the challenges, but also looking for solutions. And I want to start by just maybe briefly referring to, the father of antibiotics, the person, Alexander Fleming. Late last year, I mean, Paul, you and I were actually together in a meeting in London on 7 November last year, where we talked about communicating AMR as well. And there was somebody there presenting from the Fleming Initiative, and they shared with us some of the wonderful, innovative and very creative work they are doing to communicate and engage the public around AMR, but also this 360 virtual lab tour of Alexander Fleming's lab that's online that I really enjoyed visiting, and I can recommend. But it also reminded me, of course, that Alexander Fleming already on 11 December 1945, in his acceptance speech of the Nobel Prize, he already sounded a warning that a day may come when there's a danger that people would, underdose themselves, as he put it, with antibiotics, and then microbes would develop some kind of resistance to this medication. So AMR is nothing new. Already shortly after antibiotics, was sort of recognized and came into public use, Alexander Fleming already reminded us of this danger that we may one day face. And today, my participation in AMR is as part of this network. It's got a very sort of mouthful name, a Just Transitions Framework for Sustainable and Equitable Mitigation of Antimicrobial Resistance. It's a group of scientists, mostly social scientists, funded by the British Academy, and we meet regularly to reflect on specifically these social justice concerns. So we recognize, of course, that AMR is complex and it's multifaceted. It's an interplay of so many different moving parts. It's typically recognized as one of these super wicked or post-normal science problems. It's complex, it's urgent, it lacks clear solutions, and although the stakes are high, we don't always know how to respond because there are a lot of uncertainties and a lot of disputed values. And so in Just Transitions, we also look at so-called solutions, because we know it's not only about reducing the use of antimicrobials, it's also about understanding why people are dependent on them and why we have access versus excess problems, or overuse versus shortages in many cases. And we also recognize, broadly speaking, that if you simply regulate antibiotics and other antimicrobials, it may actually increase the problem. You may have public resistance and non-compliance for many reasons. One of the terms that gets used a lot in our meetings are the unintended consequences. So often when we try to manage or mitigate or regulate these problems, we do it with good intentions, but if we don't really understand the societal and social context, it's very possible that what you're trying to set out can actually either not be achieved, or you may actually achieve the opposite effect. So I'm very happy to share my slides afterwards with anybody who wants to see them. But as a group, when we started out about 3 years ago, we published this piece on the conversation to explain what we are about and what we set out to do. So if you want to know a little bit more about this British Academy funded group, it's easy to find. We have a website as well. So very briefly, when I started looking at AMR from a communication perspective, I quickly realized that there are so many organizations communicating about AMR. There's lots of messages out there. We certainly, as far as I can tell, we don't need more communication about AMR. What we may need, arguably, is better communication about AMR, more strategic, more coordinated, more synergistic. A very, very quick search, online will give you a number of networks, some regional, some international, some quite local, and some of them doing very innovative work. If you look at YouTube videos, social media channels, just websites, comics, there are so many channels, so many outputs being used to communicate about AMR. And the problem is then, despite all of this, something that caught my eye is this World Health Organization poster, a part of their Africa campaign, that they call antimicrobial resistance the global healthcare crisis that you have never heard about. And we all might have heard this idea that AMR is sometimes referred to as a silent pandemic. Now, I know some people say we should stop using that language because, you know, maybe we are adding to the problem by calling it the silent pandemic. But still, there is this idea that despite all this investment, despite all the efforts, somehow people don't quite connect with this problem the way we hope we will. We don't quite see the public involvement, the public engagement that possibly we need. So when I started thinking about AMR as a communication problem or an engagement problem, you want to ask the basic questions that you would think about in a communication strategy. You know, who is doing the communication and who are they trying to communicate with and why? What are they actually trying to achieve? Do they make it clear? Do they really perhaps know themselves what they're trying to achieve? But on the other hand, what are they actually achieving? What effect is all of this having? Is it any effect that we can possibly measure? And where is all of this taking place? Is there a difference between world regions? You know, notable differences, some areas maybe over-communicated, some areas neglected. Of course, you want to maybe investigate and explore some of the tools. And we want to understand, in terms of evaluation and evidence, what can we do to improve what we are already doing? And so I thought, okay, as maybe the first step would make sense to try and see what do we already know about effective public communication and engagement about AMR. So I set out to do a scoping review of 10 years of scholarship on this topic. And I found this a really useful for me personally, and I hope it will be useful for others as well, exercise. It was published, it's quite hot off the press, it was published very late last year. It's a sort of 10-year scoping review of all the articles I could find, and of course all the details will be in the article about how I searched and criteria and so on. And this was published as part of a bigger set, a special edition on antimicrobial resistance, just transitions for shared future. So the first link on the slide is to my article specifically. The second link is to the bigger set of this special edition. So in my review, I came up with the idea, well, this is what I found, that there were 9 core themes that kept on emerging across all of these or most of these articles. And I summarized today for you very, very briefly, of course, just what we found or what I found. I worked with one co-author across these 9 themes. So the first one was this idea that we need to really move beyond just raising awareness. It's not that awareness raising is not important, but we have to really ask ourselves, what are we trying to achieve? To what end are we doing this? Most AMR campaigns and many other projects still prioritize the idea of awareness raising, but we know from social science research that knowledge does not necessarily equate or lead to behavior change. So we want to bring in more social science theory. We want to really understand how we can arrive at more measurable behavioral outcomes that we can measure, that we can be more strategic in the way we communicate. The second theme that really is prominent is that AMR communication cannot be transferred from one part of the world to the next. If we try to do a generic approach, it often lacks local relevance, and therefore it's really important to tailor it to context and to co-design locally with communities. And along the route, of course, we want to be sensitive to cultural differences, to language diversity, to social justice concerns. We want to respect local knowledge. The next big theme is it's not only about providing information. Can we move to a more dialogic, more engagement approach? Can we be more inclusive and more fair and in the way that we communicate and really involve communities? Is it possible to recognize publics as partners and not just passive recipients? And very importantly, to move beyond public engagement as a token consultation, but really making it something real and tangible and meaningful in the way that we involve communities. Of course, another theme, being a communication angle, one would expect this, is many of the papers I reviewed and read and analyzed focused on the issue of language and framing. We know and we understand and we can imagine, for people who are not scientists, antimicrobial resistance is a long and abstract term that's difficult to remember. It may feel very distant, irrelevant, and even alienating to people. And therefore, many of the scientists are suggesting some kind of reframing and advising us to also think about not only about the language itself, but the way we present it, the metaphors we use, the kind of words we use, and importantly, of course, also the images we use. And they ask whether it's possible to think about framing AMR instead of using blame and fear and that kind of metaphor, to think about solidarity, fairness, intergenerational responsibility. Is it possible to frame it in a more positive way? In other words, calling on people rather than scaring people. I don't have time today to show you all of the articles. Of course, I reviewed 88 articles in total, but here's just one example of an article that really gave me new ideas about how language affects how people respond, and how more accessible terminology can make a difference, and how public participation can be used to help develop new metaphors and new terms that actually resonate with people. And if we use the right language, the difference it can make. I don't want to assume or give you the idea that I think this is easy. AMR is a deeply embedded term, and it will not be easy, or maybe not even possible, to replace it altogether. But it's about thinking about different ways of framing it, different ways of telling the story, and also different ways of doing it across different languages. I want to just quickly, before I go on with the 9 themes, show you one or two of the images that and sort of examples of language that jumped out at me. So to think about something like this kind of campaign where it says, will he reach 20? Maybe not, if antibiotics become ineffective. So to think about, how effective is that kind of approach where you almost make people scared about a post-antibiotic future. And of course, you also have this kind of image that is, let's quickly see, much more dark, sort of a much more gloom and doom kind of image that is often used in campaigns of this idea that we may be heading for a so-called post-antibiotic era and what it may look like. I was also very interested to look, for example, at materials produced by the World Health Organization, specifically for Africa region, and thinking about this kind of image, where we are, it's also quite aggressive, in a way quite scary, and the kind of language that is used about misusing or regretting the misuse of AMR. I think in general, what I took away from my review and from looking at some of these examples, that we really lack information at this stage about. We need much more research about language, about framing, about images, and about the effects it has on audiences. So linked to the language issue is this idea of actionable messages. Very often the messages in current campaigns, even in social media campaigns, are quite vague and lacking clear or feasible calls to action. And therefore scientists are really calling on us to think more carefully about who our audiences are and what agency they have. What can they possibly do about this AMR problem? And then to, based on that, come up with more clear, specific and achievable steps. And also that scientists need consensus about what we want the public to do. Is it the most important message to tell people to finish a course of antibiotics? It's very confusing for people if some scientists say yes and others say no. So it's also a question of consensus about the actionable responses we want from the public, and how we can maybe use trusted messengers from the public to do this. And the importance of co-developing once again and pre-testing to make sure that we are actually achieving what we set out to achieve. I want to quickly pause for a second and ask, I don't know if it's possible for people to respond, but just to think about, there was a brief reference in the previous presentation to the November, every year in November, World Health Organization commemorates World Antimicrobial Awareness Week. Can anybody remember what the theme was for 2025, the most recent one, November 2025? What was it all about? Because every year they choose a theme. So what was the 2025 theme? Please don't Google it now, but can anybody remember what it was? Oh, can you remember? I'm putting you on the spot, sorry.
I cannot remember. I can't remember, Marina. I'm just looking if anyone is putting anything in the chat. Act now.
I see somebody has got Act Now. That's actually not too bad at all. So this was one of the posters from the World 2025 campaign. Act Now, protect our present, secure our future. Now, I'm not here to criticize the World Health Organization in any way, but I just for me, maybe one of the kinds of campaigns that we need to think about, or the messages that we need to think about. What does it really mean to people if we say act now, protect our present, secure our future? If you didn't know that this was, linked to World Antimicrobial Awareness Week, you probably wouldn't. Maybe, well, in the context you might understand it, but it's just, for me personally, it's an example of maybe a very high level message, but maybe very hard for people to act on. So just something to think about. This is what I mean by messages that are actionable or not actionable. And I would say this one is not actionable. People wouldn't necessarily know what to do if they saw this call. Because act now could mean so many things. Okay, I'm back to the themes. Remember, I told you there were 9 themes. I've already spoken about the first 5. The 6th one that came out was revive media interest. We really need to work with the mass media. In general, these scientists recognize the importance of working with journalists and social media influencers, but they also recognize that media interest in AMR is sporadic and sometimes quite low. So why is it such a hard story to cover? Why is it not more appealing? If it's so important and life-threatening in many ways, why is the media not playing a bigger role? So there are many suggestions about how we can revive media interest, encourage what is often called solutions journalism, sort of a more positive spin on what people can do, how we can bring in community voices, how we can encourage more local stories. The 7th theme, so getting towards the end now, is this idea of creative approaches. At the moment, there's a lot of interest in storytelling, theatre, comics, games, and in similar ways to make AMR more relatable, more engaging, more memorable. And in general, there's broad recognition that this is a encouraging trend and that it should be supported and encouraged. But at the same time, there's a little bit of a warning that just adding cartoons and images does not mean that something is going to work. We still have to be really careful about accuracy and cultural resonance, and we really have to be careful about emotions, but use emotional connections effectively. But there's also some danger there if you don't do it well. Once again, co-developing and pre-testing with communities to ensure accuracy and resonance would be key. Here's just a few examples. Recently, there's been a number of online events and talks. I'm sure many of you have been involved about storytelling in AMR, various groups around the world working on games. I came across recently during World Antimicrobial Awareness Week this event, Poetry Against Superbugs. In Cambodia, there's an interesting project where they have an AMR circus that travels around the country. One thing that stands out for me is that in creative approaches do not always travel well. What works in Cambodia is probably not going to work in South Africa, etc. So once again, need to be careful. And also, I had a student a few years back actually that did an analysis of science comics on AMR, and it was surprising to us to find that many of these comics were creatively quite well done, quite well executed. But it was not always, but in some cases, quite hard to find out who were they really aimed at, sort of what age group, and what did they want the children or the teenagers or the young adults to do with the information? How did the creators of the comic want them to respond in the end? So yeah, just once again coming back to that idea that simply using something creative like storytelling, film, or comics will not necessarily guarantee success. The 8th theme that came out of my review is that, yes, we have large campaigns, of which probably the most well-known one is World Antimicrobial Awareness Week, but there are also other large campaigns, but that it's maybe time to rethink these campaigns because they are often expensive, they're quite short-lived and generally poorly evaluated, or if they are evaluated, the evaluation outcomes and materials are not publicly accessible. And many of them are to some extent at least focused on top-down materials and not really tailored to local context. So they don't really comply with all the other suggestions we already discussed. So it's necessary for them as well to really think about goals, outcomes, and audiences, and to become more dialogic, more creative, and more local in the way they are implemented and designed. And perhaps it's possible to achieve better coordination. And then the last one, so you will already see that all these 9 themes are connected and interrelated, and sometimes there's a little bit of unavoidable overlap. We really need more information about how effective these interventions are. Very few are rigorously evaluated, or in very few cases evaluation data is available so that others can also learn from it. So it's about measuring, understanding, engagement, and behavior change. It's not just about measuring numbers and clicks and likes. And of course, the way evaluation is done is very important. It shouldn't be an afterthought. It should be an integral part from the start. And evaluation of big science communication interventions or campaigns have become such a sophisticated endeavor. You really need people with expertise to do that. It's not something that somebody can just quickly add onto a campaign. It's something that also needs to be budgeted for. So for me, the take-home message from the whole review was that communication itself should be part of the AMR solution, not an afterthought, but it can be seen as a form of collective problem solving. It's not easy. It's a very complex and very multifaceted approach that will be needed. But, you know, of course, can we afford to do it? For me, always, of course, the answer will be, can we afford not to do it? So what I did to try and also take it a little bit further is I also wrote a popular summary of the review, and that was also published on The Conversation in December last year, available at this link. Also, I want to tell you that several of my colleagues who also participate with me in this British Academy group, just really hot off the press, published this social science review of AMR interventions, sort of something similar, but they look at it more broadly at many social science interventions. This was published in the Lancet Microbe, but inside there's also an article that says overall the evidence base for the effect of awareness raising activities is weak. Also talking about the problems of the way that communication is done and designed at the moment in the AMR space. So that is also available open access if you're interested. Personally, my next step in my own research, I'm specifically interested in the scientists, the AMR researchers themselves. I would really love to do, and I'm sort of working on designing this at the moment, to explore attitudes and perceptions of AMR researchers, maybe in the global south and possibly starting with South Africa, how they see their roles and their responsibilities, because they are certainly not the only or not even the most important role players, but they are crucial. We need the experts to be available to the media. We need the experts to come and have a public say and play a public role when they are called upon. It's not AMR communication, I do believe, is not something that can be delegated to communication experts only. We need the biomedical and social science experts as well. So we want to look at their current involvement, but also how they would love to be involved. What are the incentives and barriers to involvement, and what kind of support and training could help them? And then the last thing I want to tell you about is that as a or deputy editor of this journal of JCOM, we are going to be calling soon for a focus collection or special edition on reimagining AMR communication, strategy, stories, and social change, with those people and with Paul, you of course involved as one of the guest editors. That call will go out quite soon, and I would love to also distribute it via this network. And if anybody is interested to write up a practice insight or a piece of research, an opinion, an essay, there are various forms that your contribution can take. We would welcome that. And with that, I'm going to wrap it up. Thank you.